Sir has a vast experience in presenting different subjects on various notable platforms across the globe, conducted Sharakarma and Agnikarma in PILES free camps once in a month for 6 months at SDM College of Ayurveda Hassan from August 99 to 2000, worked as visiting faculty at SDM College of Ayurveda from 2001 to 2004, has published research paper on Sharakarma and Agnikarma in different types of files in NEMA Journal 2002 and Ayur Medline in 2002 as well. Presented paper on Sharakarma and Agnikarma at a national conference on Samajadharma at SDW College, Udupi. Established Sushruta Ayurveda Hospital in Puttur on July 2002, in which Sir has been treating many challenging cases with various forms, various modalities of Ayurveda as an Atyayik Chikitsa as well. He has till now, since 1991, cases of files like Sharakarma and Agnikarma. Has presented guest lecture in different seminars and different Ayurveda colleges on the subject of Sharakarma and Agnikarma and Rakta Mokshan by Sira Vyadana, which happens to be his a speciality as well. Sir has also presented as a guest lecturer on the subject of management of acute stroke syndrome, who was also part of our seminar where Sir had presented it as well. He has a complete 25-bedded hospital, the facilities in Sushruta Ayurvedic Hospital, a fully equipped operation theatre, dispensary, consulting room, reception lounge, laboratory, ECG and ICU as well. He is recognized as a guru from Rashtriya Ayurveda Vidyapit, New Delhi, 2016. He has vast accolades to say, a very knowledgeable and brilliant person as well, and his cap has many efforts curing various diseases with Ayurvedic modalities. So I'll request Dr. Parvade sir to kindly start his lecture on Atyayik Chikitsa in the management of Shwas. Thank you very much.
Thank you very much. So am I audible? Hello?
Clearly audible. Yes, sir.
Yes. Thank you. Thank you. First of all, I am thankful to organizers for giving this opportunity to share my experience of treating different Shwasrogas. So first, let us pray Dhanvantari and Guru. Guru Brahma, Guru Vishnu, Guru Deva Maheshwara, Guru Sakshat Parabrahma, Tasmai Shri Brave Namaha. All begging Ashirwad from all the Gurus. With their Ashirwad, I am going to present management of Shwasroga by Ayurveda. As you told, it may not be of only acute thing. All the Shwasroga I will discuss. First, I will discuss about what is the sexual advice is there. Then how we can analyze in today's in 21st century situation these things. Then at the end I will discuss some cases orally, because I could not in Shwasroga we can't have this presentation different patients. That is difficult, but I will discuss some cases at the end. So Shwasa, as you all know, for an introduction, sexual things about 10-15 slides I will tell. Everyone know, everyone studied this one. Kasa Buddhya Bhave Shwasa. One is Shwasa directly can occur. Another one is by increasing of Kasa end up with the Shwasa. Then this is primary Shwasa. Secondary Shwasa can occur by Atisara, vomiting, by Visha, by Pandu, by Jara. Secondary cause. By that also, as a complication, Shwasa can happen. Then Raja, Dhuma, Anila and Marma Aghat, any injury, that also cause Shwasa. So since Kasa increases the Shwasa, how Kasa occurs. That is why we have to see Kasa Nidhan. The many Nidhanas everyone of you know. Especially this Apanavayu coming with the Udana, you get this Shwasa. This is all what he tells here. So then Shwasa Prabheda. Shwasas are, as you know, there are 5 types. Shudra Shwasa, Tamaka, Chinna, Mahan, Urdhva Shwasa. This Chinna, Mahan, Urdhva is Asadhya. It's the last stage, end stage of any disease. You get to these things. Tamaka Shwasa is Yapya, that Shudra Shwasa is Sulabha Sadhya. I think Tamaka Shwasa is the thing what we get in a day-to-day practice. We have very good approach in Ayurveda. These things we should think of. And whatever Asadhya is told in Ayurveda, it is Asadhya, even from a modern approach also. So, how, as a Pura Rupa, you will have all these Lakshanas. And in Tamaka Shwasa, initially you get the Pratishyaya, then goes into in the nose, it will be there, then it goes into Kantha and Pupusa, a whole Pranasota is involved, then you will get the Tamaka Shwasa. So another thing is Shwasa can occur by Pranavata Udana, so then also you will get. So here Vata Prakopa is how it has happened, he has explained. Then for getting actually Shwasa, there should be Pranavrata Udana. Then you
Dr. Vidya Malkade, kindly put your mic off.
So,
sorry for the interruption, sir. Continue.
It's okay, sir. So these are the things it is explained in Ayurveda. Sarvek Rogo Nashanaya Thivram, in all these things, Shwasa. And also in the Hikka, he says, Shigrakarine, it is very fast happening. That is why any Shwasa Roga, you should think it as Shigrakarine, Atyaika. Chikitsa should be Atyaika. So that is why there is nothing like Atyaika Shwasa Chikitsa or these things. We can tell in between the this Shwasa episodes, there will be, you can tell it as a chronic. But whenever Shwasa occurs, then it is Atyeka. That is why he says Shigra Karina. So immediately you have to do the treatment. Otherwise, patient may end up with Mrityu. That is the thing. So the Chikitsa is explained. Is first is Svedana Chikitsa. Snigdha Lavana with the Thaila apply over this one chest and back, and Grachita Kapha occurs. That is why you get the relief from Shwasa. That's what he says. Then after that, Bhojana, or you have to do Vamana and Virechana should be done. Usually we by heart in this sloka in the Granthas, Shwasetu, Tamaketu, Virechanam, there to be by heart it. But according to Avastha, if there is a Kapha Avaruddha is there, in Srotas is Avarodhavi Kapha, Sputam is there, then he says in that stage you have to do Vamana as a first line of treatment. Then you can go for Virechana. Then question comes, what type of Vamana Virechana you do? Usually we learn that for any Vamana, you have to do Snehapana for 3 days, 5 days, then a Samyak Snigdha, then a Svedana, then Vamana should be you should do. It takes 5 to 7 days, but the patient is coming in Shwasa acute state, how you can do? This question arises. So how Virechana can be done? That is why he says here, Dadyato Asnehi Vamanam Mrudu Vamana. That is Sadhyo Vamana should be done. No need of Snehana. When there is a Utklesh Avastha, that is why Charaka says, Avastha Vashena Chikitsam Kuryat, in which Avastha patient comes. Like that you diagnose and give the treatment. It may be against actual advice. If in that Avastha, when there is a Kapha Utklesh Avastha is there, then without seeing, doing this Snehana, all these things, already Uklesha is there. So just you do Pitpali Saindava with the Kshaudra and do Vamana Karma. And like that you can do the Hingulu Tumbi Yukta Anuloma Virechana also can be done. So usually what I do in my practice here is I take do Abhyanga and Upanama Sweda for all on the chest area. Then we give Mruduvamana, Sadhyavamana we do on one day. Next day, when patient gets relief immediately, next day we give Eranda Taila with the Gomutra and Godubda. You see, Eranda Taila for a virechana. Eranda Taila, if you given with the milk, it is Pitta Sanyukta Vatahara. And Eranda Taila given with Gomutra, it is Kapha Sanyukta Vatahara. When Kapha with both Sanyukta is there, then Eranda Taila is given along with both Gomutra and Godubda. Then we give for Prudu Virechana. About 4 or 5 Vegas occurs, then patient gets relief. Here also, after Abhyanga and Upana Sweda on the chest area, we do then do the Sadhyavamana and Sadhya Virechana. Once Koshta Shuddhi occurs, then we can start Rasayana Chikitsa. Shamana Vishadyan, Rasayana Chikitsa can be done. This is what I usually do in my practice here. Most of the Samakashwasi patients, even it is told that Samakashwasa is Apya. By this method, after doing Sadhyavamana Virechana, in the Grantha it is told Pakshe Pakshevamanam Mase Mase Virechana. What I do, once you do Mruduvamana Virechana, then after we will give Rasayana, after 15 days again I do Mruduvamana. Then again we give Rasayana. After 15 days again we will do Vamana and Virechana, both. Mase Mase Virechana. Like that, if you do cycle of 3, 4, 5 cycles you do, patient almost complete, many of the patients completely they get relief from that Samakashwas. That's what I have seen in many of the patients. I think it can be adopted by any treating physicians in their practice. It is simple thing. It is a OPD level. No need of admission also. Just you do Abhyanga and Upanasveda and give him Yashti Madhuphanta, do Amana, Mrudu Virechana, Mrudu Amana. Or Pitpali Saindava with the Kshaudra also you can do Mrudu Amana. Next day you give Eranda Taila with this one, give Virechana. This can be done in OPD level. Then after once 2 days you do, then you give Rasayana. What Rasayana I usually use, if it is say Pitta Sanyukta, I use Bhargava Prokta Rasayana. Whenever Kapha Sanyukta is there, Agastya Harisaki Rasayana is given. Keval Agastya Harisaki Keval Vata is there. If Kapha Samsarga, Abhayamalaki Rasayana, like that I change the drug according to presentation. So this is what Vamana Virechana. I think this is a main, this Sadhyavamana Virechana is a mainstay in the practice of Shwasa. That's what I have find out. Samshodhanasya Sopratikam. Then after once you do this Samshodhana, usually the Srotas becomes clean, and even since it is an Amashayobhava, then Koshta becomes Shuddha. Most of the patient gets complete relief from Shwasa. This is what you can do in your practice. Then Dhumapana. Some persons may need Dhumapana. You can utilize this Dhumapana also in your practice. Usually after Vamana Virechana we do Vamana, I give Dhumapana. As a regular practice I don't utilize this Dhumapana in my practice. But usually I think that it will become sufficient in most of the patients. I never seen a patient is getting failure. In all the patients you get result. So when Vata Pitta Anubandha is there, you see Pitta Anubandha is there, then Kshira Kashaya. Especially I give the patient a Yashti Madhu Kshira Kashaya or Bala Jira Kali Kashaya. This is what I utilize. When Vata Kapha is there, I utilize Bahushleshma is there, Dashamula Katutayadi Kashaya. Here he says to use Go Rasa, Go Straja Rasa is there, they are told. But I don't utilize in my practice. But I utilize this one and another is Panchamutrasava. Panchamutrasava is Gomutra, Desi Gai ka ghee, Mutra, mixed with the 1/8 of Haritaki Churna and Ilaichi, Lavanga, this mixed and kept for 1 week. Then you filter it, utilize it. That is Gomutra Asava. That is what, instead of Panchamutra, utilize only Gomutra. I give it to the patient. When Bahu Shleshmani, this one is there. This one, Shwasa is there, Tamaka Shwasa. I use this one. But one Vata Pitta Pradhana is there. The drug use is Balajira Kadikashaya or Draksharishta, Kanakaswa. These things I utilize. So, Chikitsa Sutra, I think it is told in our textbook, Vatanromana, Kafahara, Vatakrutva, Kafahara, Kafakrutva, Anilapaha, like that, different fermented combination is there in the text. It is a textual advice, everyone knows. So, with this introduction, a basic grantic introduction, how we can do, how you see in our patient, how they present. Any Shwasa patient, they come with one is, most of them come with the nasal block, initial stage. In this stage itself, if you treat him, this Pratishyaya, you will not go to next stage, this Shwasa stage. So, this Pratishyaya state, what I do is, do Sadhyo Hadyavirechana and give him Sarshapa Taila with the Saindhavalana for Pratimarshanasya. Daily. If you do this one, continue, and Lavasut Shekara and Triphala Gugul. Triphala Gugul means it contains Pippali. So, continuously, they will completely get relief from this condition of Pratishyaya. Some persons may have nasal hypertrophy with this Pratishyaya. Unless you remove this nasal hypertrophy, it will not go. In such condition, I do Khara Karma for nasal hypertrophy. That shrinks in size, patient gets complete relief. Once this is gone, naturally next stage of Shwasa will not occur. That is what I am saying. We can prevent a patient is getting into next state. Then when it is in pharynx, Kantha, patient may have cold, all this, cough, this, Kasa will be there. So if you treat this condition also, here, usually I utilize the drug is Mrutyunjaya Rasa and Kamaduda Mukta with the Amritarishta. This is the state. Or Arogyavardhini. If more Kapha condition, Arogyavardhini give, more Pitta condition, give Kamaduda Mukta. So when this condition is prevented here itself, next step it will not go. When it goes here, then patient gets the complete Samaka Shwasa conditions, or when it goes here, patient may go into chronic state, COPD, that is obstructive pulmonary pathology will be there. Then you have to go for Sadhyam Hadyavirechana, Abhyanga Sweda, all these things. Chikitsa should be done afterwards. So this is what, sometimes what happens, now in COVID conditions what we see is that instead of obstruction here, this arterial or capillaries are there, they are blocked by clots because of virus. Host and antigen complex, there will be small clots occurs in these vessels, so that there will be collapse of the alveoli. So area of the gaseous exchange is less, so there will be restrictive type of breathlessness will be there. So in these conditions also we can have different treatment pathology. Treatment should be not for this condition. Here this clot should be removed, like that treatment should be given. This is what we have to do. So now how it can be done? As according to Dosha Siddhanta, Hetu Linga Vashana Jnana, already I think last time I explained, patient comes with the Linga, we have to find out Hetu, what is Hetu. All these Hetus I explained, what is that you have to see and give specific treatment. There is no Roga without Dosha. Hetu is always Dosha. Doshas can be understood by its linga. In that Vyadhi, you see, according to linga, you find out which dosha is involved and give specific treatment. Hetu sthana vishay bhaved roga visheshaha. Hetu Vishesha and Sthana Vishesha. Yatha Dushtena Doshena. Since it is Vata Dosha Prakopa, always we should think how this Vata Dosha Prakopa occurs. By Dhatukshaya or by Margavarana or Dhatukshaya due to Marga. By all these means you can get a Shwasa. So by Ruksha Shita Viruddhahara Viharas, there will Dhatukshaya occurs Vata Prakopa leading to Sansamshaya, a Shwasa can happen. Or by Margavarana. Kapha, Pitta, Rakta, Mamsa, anything can do Avarodha. Prakupitavata gets Sansamshaya, you get the vector of the disease. So in this condition it is actually Koshtanga in the Pranavasota Chakra. Then initially Avarana pathology is more. If you don't treat him slowly, he is converted into Dhatukshaya pathology. I think this COVID condition is the best example for this. Initially they come with the breathlessness because of this Avarana. There will be Rakta Avarana is there. But as time passes on, they come with the Dhatukshaya. That is fibrosis of whole lung occurs. Patient is going to have a collapsed lungs. Dhatukshaya Avastha Vata Prakopa is there. Patient may come in any stage. You have to find out, is it in Avarana stage or Dhatukshaya stage. The treatment modality will differ from person to person. So, to understand this one, how you say, Pitta Avarana, Daha Krishna Shulam Brahmastamaha, Shaitya Gaurav Shulani will be in the Kapha Samsarga. In the Rakta Avarana, Daha Arthi Tvakmam Santarojabulam. There will be Daha, Arti in between Pakka and Mamsa, Raga, redness. So Mandalani Shvayatu. Mandalani Shvayatu is anywhere a Shvayatu can occur. It can occur anywhere in the body, but it is Ekadeshaja. So, and another is Spashadvesha. This. So, how a Raktavarana pathology can happen. So, before that, I will explain how this Avarana and Dhatukshaya can happen. This is very important. Many of them they don't give more importance to this pathology. This cha, Dhatukshaya due to Margavarana. This practically we can see in all the most of the patients. Initially they come in Avarana state. As time passes on, because of this there will be Dhatukshaya state in that particular area. This you will see. It can be understood by a simile of river. You see, river is flowing. One initially Kevala Dhatukshaya, from Moola Srota itself, whole river, if you see in the summer season, whole river become dry. Whole water filled area is filled with the air. That is Dhatukshaya Vata Prakopa. Second one is, your river is full of flow, you put a dam, Margavarana. Any Kapha, Pitta, Rakta, Mamsa, Madhya, Shukra, any stable entity can block movement of fire. When the dam is put, then water level increases. Vata Prakopa occurs. How? Avarana, Vata Prakopa, Vimarga, you get a disease. In acute state of COVID, or acute state of bronchitis, acute state of any other infections, pneumonitis. What happens? There will be Avarana, Vata Prakopa will be there. Patient gets severe Shwasa will be there, Vata Prakopa, leading to Stansamshaya, you get Runashota, there will be Shwasa will be there. That is Avarana Vata Prakopa. If you don't treat him, what happens? Because of this, there will be degeneration of the lung tissue. That is Dhatukshaya. That is initially Avarana symptom. As you don't treat him, they will slowly convert it into Dhatukshaya state. In a chronic COPD, patient goes on losing his lung tissue. Bronchiectasis occurs. Continuously it occurs, continuous process. When patient is in complete Dhatukshaya occurs, then will be insufficiency of lung area. Patient go into the breathlessness, Shwasa may occur. When it is in Avarana state, then itself if you treat him, when dam is full is there, then itself if you remove this Avarana, no chance of Dhatukshaya. What happens below stream, below this dam, there will be water filled area become slowly dried up, river become dried up. That is Avarana Dhatukshaya. So, initially patient may come in the Kevala Dhatukshaya, Avaranavastha, Avarana Dhatukshaya. All three means patient may come to you. So, you have to find out which state, which avastha he comes, like that you have to treat. So, this, I think this everyone understood. It's a very simple concept. So, with this, then, because in Ekadesha usually it occurs with Raktavarana because in Raktavarana Mandalani Shweta occurs. In Ekadesha it occurs. A Shwasi is Ekadesha Vyadhi. So always occurs due to Raktavarana Vata Prakopa. So how this Raktavarana can happen? What is Raktavarana? You see, Vayu and Rakta both are moving entity. If you compare Vayu and Rakta, Vayu is Sukshma and Chala, Rakta is Sara and Drava. Both are moving entity. When you compare Vayu and Rakta, Rakta is Sthula than Vayu, Vayu is Sukshma than Rakta. Both are moving. So one should move, block others. Rakta should block Vayu. How it happens? It can understood by a simile of a traffic. In the Rakta Srotas is blocked, or Rakta itself can block the movement of Vayu. Just like in a traffic, heavy vehicles, lorry, bus, etc., small vehicles, bikes, scooter, etc., everyone is moving. So anywhere one road is damaged, Rakta Srotas is damaged. Or one lorry is damaged, Rakta is damaged, Rakta Dushti happens. Then next lorry comes, that will be stopped, it will not move. Still you negotiate your bike. After 3, 4, 5 lorry bus comes, it stops, accumulates, then your bike also will not go. First Rakta stops, then this Dushita itself blocks movement of Vayu. Then Mandalani Shayatu, accumulation of vehicles. Heated exchange between drivers, Daha, Raga, pain, Spashadesha, these things occur. Patient may get Santapa. All our body goes, there will be Santapa can happen. So this is nothing but an inflammatory condition, that is Vundashota. It occurs in any Pranosrota, anywhere it can happen. Initially, there will be in that area only, Kasa will occur. Kasa increases, that will be converted into Shwasa. This is what happens. So, bronchitis, pneumonia, bronchiectasis, this all conditions can occur by Raktavarana Vata Prakopa. So, to this happen, there should be Rakta Dushti. Rakta Dushti may be because Rakta is a Dhatu. How a Dhatu can block movement of Vayu? Vayu is a dosha. So, a Rakta cannot block by itself a dosha. Rakta can block when Rakta is Dushita by doshas, then only it can block the Vayu. So, Rakta Dushti may occur by these Ahara Viharas, Pitta Swarupa Rakta Dushti, Kapha Swarupa Rakta Dushti, or Vata Swarupa Rakta Dushti. You see, first line is Pitta Swarupa Rakta Dushti Karanas. Second and third is Kapha Swarupa Rakta Dushti Karana. Third, fourth and fifth, Vriddahara, Chaddi Vega, Patighata, all these things, Kale Chamasan, Vata Swarupa Rakta Dushti Karana, or Abhigata, a trauma. That is why he says Marma Ghata. Marma Ghata is one of the cause for short. By Ahara Viharas, Udduli, all these things, all Ahara Viharas can cause Rakta Dushti, Raktavarana Vata Prakopa. This is one Raktavarana Vata Prakopa, Ahara Vihara. This again, Pitta Swarupa, Kapha Vata. Which dosha of Rakta Dushti, Raktavarana Vata Prakopa leading to Shwasa? It may have a Kevala Vata Lakshana or Pitta Samanvita or Kapha Samanvita. I think we can understand this different symptomatology presentation will be there. So when Pitta Vata is there, the Chikitsa is different. When Kapha Vata is there, Chikitsa is different. When Kevala Vata is there, Chikitsa will be different. So you have to diagnose how it is presents you, like that you have to understand and give treatment. And there are many Shonitaja Vyadis there, or Shonita Anubandhaja Vyadhi. What I am saying now, Shwasa is Shonita Anubandhaja Vyadhi. So to this happen, one is Ahara Vihara, and Abhigata. See, third cause is Raktaja Krimis. That is why by any krimi, Rakta, Paya, Vikaran, Janayanti, Te, Pushta, Visaka, Pidaka, Adi, this Pidaka is Runashota. It can happen anywhere in the body. Tapmamsa, Sirasna, Sanjasti, Marma, Koshta. Abhigata, Ahara Vihara, you can get this one. So it can happen anywhere. Tapmamsa, Sirasna, Sandhi, Asti, Marma, and Koshta. It is occurring in Koshta. It's a Shwasa. Your lungs is nothing but a Koshtanga, and it is a Marmasthana. So both chances there. It's a Hridaya also Marmanga. If anything happened to Hridaya, patient will go into the Shwasa. It can happen. So Rakta Dushti Vikaras. Then 5 Abhigata. Chikitsa could be Shalya Chikitsa. If it is Dosha Dushti, Dosha Amavachana Chikitsa should be done. If it is Krimi Chikitsa should be done. There are many Krimi Chikitsas are there. You see, Gomutra is there, Charodaka is there, Karanjaka, Nimba, all many drugs are there. Kirmi, Prakriti, Chikitsa should be done. So, but when in this all these cases are Shodhana and Shamanas, we should do by good gurus, all these things. Rasaushadis, everything, Kashaya should be done according to dosha presentation. For example, patient comes with the Santapa, Jvara, and Shwasa. We usually utilize the Rasaushadis. You see, for example, if you take Trigona Kirti Rasa, Singulam, Visham, Yosham, Tankanam, Nagarisham, Surasar, Drakahema Bihi, Surasar, all Krishna Tavyas are there for Bhavana. It can be utilized when there is a Vata Kapha Jeste. When Vata Pittaja, Singulam, Visham, Yosham, Tankanam, Gandhakam, Samam, Nimboka Sarasa, and the Vairava, it can be utilized. So, when there is a Keval Vata, it can utilize the Mrutyunjaya Rasa. It contains again Parada, Gandhaka, Tankana, Vatsnaba, and Gomutra Bhavana. Keval Vata utilize only Mrutyunjaya Rasa. Like the different Rasaushadis, according to involvement of dosha, you can select and give the treatment. Kashaya also, as I have already told, Vata Pitta Jaya, Balajiraka, the Kashaya is the Daksharika. If it is Vata Kapha Bahula, the Shamula Rashta, you can utilize the Shamula Katutraya, the Kashaya is there. So, according to dosha, everything should be given according to analyze the given dosha and give treatment. Then comes when Atyeka, very severe is there. Dimbasta Sarvata Vita, Shinaga, Bahu dosha Ativisrataha, Bahu dosha Ativisrata, very status asthmaticus case is there. What we can do as POT is coming down, patient is going to die. Then he says, Amopi Stambaniya. Our treatment is Amapachana. Vata, Pitta, Kapha, Hara means Amapachana Chikitsa should be done. But there is no time to do Amapachana, Abhyanga, Sweda, Omana, we can't do. In that state, what is that? Is Pachanat, Marana Bhaya, so you do Amastambana Chikitsa. So in today's 21st century, 20th century, 21st century, we are doing all the nebulization or dexamethasone, hydrocortisone, these things we are utilizing. Can we utilize some of the Ayurvedic drug? That we have to see. I will discuss about this one at the end. Now I think this condition of, you see, for all other infections in modern medicine, there are very good antibiotic specific drugs they are giving the patient for surviving. Now in the context of this COVID situation, since there is no specific modern medicine, many patients used to die when this death has happened. The way is opened for Ayurvedic doctors in those who are working in the different COVID care centers and remote villages with the Ayurveda doctors. They have more opportunity to treat acute cases with the Ayurveda drug. They have got very good opportunity to treat acute Shwasa cases, and they got very good result also. Many of the patients are survived because of Ayurveda treatment. So I will discuss some of the cases at the end. So that is why Hetu Sthana Vishaya Bhaved Roga Vishaya. According to Hetu Vishaya, these are the Hetu Vishesha. Raktavanavata Prakopa Hetu Vishaya, again Rakta Dushti by Pitta Kapha Vata you have to see. This Hetu Vishesha you will do. Then your treatment should be adopted. When Pitta Vata is there, first Pitta should be treated, then Vata should be. When Kapha Vata comes, Kapha, then Vata. When Pitta, Kapha, Vata, all three are there, first Pitta, then Kapha, then Vata should be treated. This is what protocol is there. Then the diagnosis management. Patient comes with the cough. Is it dry or wet? You can understand it is Vataja or Kaphaja. Then when Pitta Samsarga is there, when there is usually there will be Jvara. That indicates there is a Pitta Samsarga is there. Then Vata Kaphaja, Vata Vittaja, Kapha Vittaja and Sannibhataja. Again, which dosha pradhana, like that you should select the treatment. So this is very interesting. You should diagnose it. Then again, one is this one. Second one is you have to diagnose, is it restrictive or obstructive? Difficulty in breathing, rhonchi crept. This will be there in all the cases you will see. Restrictive or obstructive. When you see this passage is obstructed by something, then getting the breathlessness. By Shalya it can happen, Marmabhigata it can happen. One is Shalya, or by anything if it is narrowed down by any means, then also patient it's a obstructive, or up to here also in bronchial also anywhere there is obstruction by sputum or this cough, these things, patient will have cough or breathlessness. Khasa or Shwasa will be there. And when it is Pitta Samsarga, when it's Runashota is there, patient may have Jara or may not have Jara. When it's Pitta Pradhana reflux is there. Kapha Pradhana reflux may not have Jara, but all these symptoms will be there, obstructive. Restrictive is, there is restriction for the gaseous exchange. That is a complete degeneration of the alveolus. Then there is no area for breathing, no area is there. That is one is restrictive. Second one is cardiac conditions. By that also patient will have restrictive breathlessness. Or there will be a pneumothorax or pneumonia, hydrothorax. Then what happens? There will be a fluid is filled in this pulmonary edema. These are all comes under. There is no space for expansion. There is no space for gaseous exchange. That is restrictive. Now in the COVID situation, what we have seen is due to virus, there will be clotting is happening in this capillary, so that this alveoli are collapsed. So patient is getting the breathlessness. His oxygen level is coming down. So this is restrictive type of breathlessness. The treatment approach for this obstructive and restrictive may not be same. For obstructive, you have to remove this one, or you can reduce this Runashota, like that you can treat. But here what happens, instead of Runashota occurring because of this clot, that clot has to be removed by any medicines. It can be, you can reduce it or you can remove. So this is the two types of breathlessness. Very important to understand. You should understand how this breathlessness Shwasa has happened. Then accordingly we should treat. So, and according to place of the pathology, where is it? Sthana Vishesha. Is it in throat? Is it trachea? Is it the bronchus, bronchioles? Is it alveoli? Or pneumonitis, hydroderm? Where is it? And fibrosis. Anything can happen. Patient you have to diagnose. But I think it can be diagnosed with the X-ray, CT scanning, and some blood investigation. I think you can diagnose today's situation. If foreign body is there, you remove. Marmabhigata is Shalya Chikitsa should be done. For obstructive thing, I think our Tamaka Shwasa Chikitsa, Abhyanga, Sweda and Vamana and Virechana, that will give excellent results. Because this sputum and obstructing because of allergic reaction it occurs, we say it as by Kapha-swarupa Rakta-drushti or Vata-swarupa Rakta-drushti or Pitta-swarupa Rakta-drushti, like that you have to utilize and give the treatment which when the dosha is there. When the krimi is there, then krimi chikitsa should be done along with the dosha amapachana. Unless you remove this krimi, how many amount of you do amapachana, you will not get relief. So the question comes, should you remove the krimi, or why krimi is not told in Shwasaroga itself? It is not told in Ayurveda, but in Western medicine they tell about all these infections. Why it is not told? That's very important. That is infection theory. So, when krimi invades into system, into the area, when there is dosha vaishamya is there, when we are in samadosha avastha, any amount of krimi in my mouth it is there, it will not cause pneumonia, nothing will happen. When dosha vaishamya occurs by ahara vihara, then only krimi invades. So that is why dosha vaishamya is the cause of disease. That is why in Ayurveda we call it as Vata, Pitta, Kapha, Swarupa, dosha vaishamya. Then only krimi invades. Once the krimi is invaded, according to that krimi's prakriti, you will have different post and antigen reaction will be there. Resultant vyadhi will have its own prakriti. That is known as vyadhi prakriti. Sushruta Charaka says Prakriti of the human being as well as Vikriti of that the disease has a Vikrita Vasavita Kapil, that you have to analyze. So Vyadhi Prakriti also analyze. So it will occur according to host and antigen reaction. You will have its symptoms. It may be Vata Pran, Pitta, Kapha Pran, Vidosha, Sanipata Pradhana will be there. Accordingly, treatment should be adopted. But with if you adopt this Krimi Chikitsa is a Nidhana Pariyojana, Apakarshana and Prakriti Vighata Chikitsa. Apakarshana is Panchakarmas, Vamana Virechana, what we are doing is same thing. But Prakriti Vighata is killing of the Krimi. Can we have many of the drugs are there in Ayurveda? Surasadigana, Surasadigana, it is utilized for Pranasrotas at the same time for Krimi also, actually Krimi Prakriti also you can utilize. But when is Rakta is involved, Raktadushti is involved, so for Raktadushti, Pikta Rasadravyas we utilize. Kantakari is there. It is both Pranasrota and Raktasrota, both areas. I think best drug is Panchatikta Kashaya. Panchatikta Kashaya will have Vasa, Kantakari at the same time, Guduchi, Katakarohini, etc. The Patola drugs are there. Both Rakta and Pranasrota can be tackled with this Panchatikta Kashaya or Panchatikta Rishta. So, according to this, we have to analyze, and it can be understood by seeing X-ray, chest and blood examination. You can diagnose, and you should find out is it by Krimi, injury or destruction, what happened. You should understand. Then management should be done. For acute management, just to see the SpO2 level usually coming down. So you see, when SpO2 is coming down, what I have seen is by giving the drug, there are many drugs are there. Talisharya Shtashunga, Tamrabhasma, Samir Pannaga or Mulla Sindur Rasa with the Makaradhvaja. This combination, if you give, if SpO2 is coming down 90, 85, you give once in 3 or 4 hours, naturally their oxygen level increases to 95, 96, 97. I think this iodine, this Malla Sindura or Samir Pannaga. And Tamravasma, this is one of the, this is known as Jantugna. Whenever there is, it is useful as a Jantugna, Krimi Prigata, at the same time, Kapha Pitta Hara. In the Pranosotas, it is drug of choice. At the same time, Raktosotas also it is the drug of choice. Yakrut Roga and Shwas Roga. In both conditions, Yakrut is Mula of Raktadhatu. You can utilize this Tamrabhasma. So in the condition of COVID, I think I am using this Tamrabhasma, Mallasindura and Makaradhvaja combination in stroke also. In infarctive stroke, there also what happens, blood clotting occurs. So that is why disease process starts. In COVID also, there is a blood clotting occurs. That is why disease process of Shwasa occurs in the COVID situations. In these both, since I have experience of treating many of the cases of stroke with this combination, I utilize this drug in condition of COVID. In many of my, usually we don't admit any patient here, COVID patient, but in OPD level we treat. They come with reduced SpO2 level, usually between 90 95 they come with. As soon as we give this drug, their SpO2 level increases. They in home isolation they used to take the drug, they get relief within 4 or 5 days. This is what I have seen. Some of my students practicing, they had opportunity to treat this COVID. They have treated with this combination, Malla Sindura, Tamravasma, Makaradhvaja. And also another thing you can utilize is Rakta Mokshana. I think one of my students, he tells he treated more than 200 cases when SpO2 is coming down to 85, 80, doing Sirayadhana at cubital vein or vein in leg, just 2 angula above Kshipramarma. Just after Sirayadhana, patient got this SpO2 level increases like anything it went up to 95, 96. But I have not done, but they have done, they have given their opinion treatment, and they have explained their experience. That's what I have seen, I have understood. Another thing is by giving this drug, whenever there is a SpO2 level is coming down, if you give this drug combination, but it should be given once in 3 to 4 hours, then only you get relief. Along with this one, usually I give Mrityunjay Rasa, Arogyavardhini, and when I utilize, when there is a clotting occurs, when Vata Kapha Pradhana is there. But sometimes some patients come with the Pitta Pradhana Avastha. This is not that much useful. Then you utilize Swarna Sutta Shekara with the Makaradvaja, Talisha Yashti Pravada, Kamadudu with Mukta, and Panchatikta Arishta. So in both kind of Panchatikta Arishta can be used, but Draksha Arishta, like that, a Pitta Kapahara Chikitsa should be done in that conditions. So according to presentation and presentation of different doshas, we should understand which dosha involved, like that treatment should be selected. So when if still it is more, you may need modern intervention. With the help of modern intervention like a ventilator or oxygen inhalation, I think if you utilize this drug, you may get relief. I don't have experience of that one. I am saying in a COVID situation. In other situations, along with the antibiotic, we usually utilize these drugs, Iver drugs, we get very good relief. Then coming to chronic thing, in between this one, especially in Samakashvasa, as I already told, the Abhyanga Upanasveda Satyam Devirechana, sometimes when there is a sinus area, plenty of sinusitis and getting many patients getting this one Samakashvasa, do Nasya Karma. Nasya Karma is one of the excellent drug treatment. Yasti Pipali Vachamali Chahimsindava is the Nasya drug. By that is Vairechanika Nasya is being given. But in such situation, don't give Taila Nasya. Taila Nasya, because of its clear it will increase, but always Kashaya Nasya is better. Or you can do Shvatagotara Dhmapana Nasya. Or Dhumapana can be done. I have not done Dhumapana. Dhumapana can be done. So these are treatment, and in between Rasayana Chikitsas, especially drugs are selected by this one also. Sometimes where more of Kapha and Pitta Samsarga is utilized, Laghu Sutta Shekara Rasa. Its Churna is mixed with Shringabhasma and Mallasindura or Tamra Bhasma or Makaradvaja. According to dosha, we see which drug is needed, like the drug is selected, or Arogyavardhini, Gandhakrasayana, Sushekara, these are selected and given to the patient. Arishtasavas, according to again dosha, Kanakasava, Dashama, Brindarajasava, we utilize in different patients. I think I can't say hypothetically you should give this drug or that drug. In all these drugs you should select according to involvement of dosha, sthana, and is it a creamy involvement or non-creamy involvement? Is it restrictive? Is it obstructive? Like that you should select the drug and give the treatment. When very archaic avastha, when SpO2 is going below 80, I think you may need modern intervention. Along with that only we can utilize our drugs. There should be an integrated approach. Otherwise it is very difficult to make the patient survive. So with this presentation, now we can have a discussion. If you have any questions, you can ask. Satata Adhyanam Vadaha Pratantra Avalokanam Tadvidyachar Sevacha Buddhi Medha Karo Ganaha. Hello sir, if you have any question, you can ask. Thank you. Hello? 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 Hello?
sir.
If you have any question, you can ask. I think we can have a discussion now. Okay?
Yes, sir.
Yeah. I stop sharing here. Hello?
Sir, Pittach Prakriti and Shwas Chikitsa, please elaborate.
Pardon? Pardon?
Pittach Prakriti and Shwas Chikitsa.
No, in when any shwasa, when pitta samsarga is not pitta prakriti, you see, human being prakriti is pitta, and this vyadhi prakriti is there. We have to treat according to vyadhi prakriti, not according to deha prakriti. Vyadhi prakriti means which dosha is involved in that particular vyadhi by seeing its symptoms. What happens? In cough and breathlessness, shwasa, there will be a jwara will be there, and sputum does not come easily. It is sticky in nature, stick to the windpipe. That is pitta samsarga, this one, pitta pradhana shwasa or pitta samsargaja shwasa. Then the treatment you should utilize is a pitta kapha is there. Always we should utilize tikta rasa dravyas, kantakari. It's vyagri avaleha or a kantakari churna. Like that you should utilize. When it is vata pitta is there, pitta with vata, then utilize madhura ganavashadi dravya. Especially I utilize usually esti madhu churna with the pravala basma. Usually patient gets relief very fast. When it is vata with pitta and kapha is there along with that, then utilize tikta rasa. When vata with only pitta, there is no much kapha is there, then utilize madhura ganavashadi dravya like yashti madhu and pravada. So another thing, very interesting thing I want to share you is that you see, in the time of this cold and fever, usually patients goes to a allopathy doctors. They give antibiotic and antipyretics and this one bronchodilator they give. Because of this drug, it is an vidahi dravya. Any modern drugs are vidahi dravya. By this vidahi, a vata kaphaja jwara may be there. Because of this vidaha, pitta samsarga will occur. They will have continuous cough and breathlessness, severe breathlessness. So because by this heat of this drug, sputum is sticked into the windpipe, they get breathlessness. In such condition, I see plenty of the patients. The simple drug I will give is Talishadi Yashte Pravala Basma with the Tulasi Kantakari syrup. Kantakari syrup, you mix it and give. And Suta Shekara and Kamadu Mukta. If you utilize it immediately, within a day they get to the relief. This is what I have seen. Whenever Pitta Samsarga is there, both cough and shwasa, both will decrease. Very fast you get the relief. Still it is more, still this one that is just you give Sadhyomana, Sadhyavirechana and Bhargava Prokta Rasayan. This is what I have the experience of treating many number of cases. Do you have any other question?
Allergic bronchitis.
Pardon?
Allergic bronchitis.
Anyhow, what I have told now many of things about allergic bronchitis only. You see, in allergic also, just we can't treat it as an allergic bronchitis. We should understand allergy happened by that has to Nidana Pariyojana should be done. But once disease happened, if there is an infection, Krimi is there, Krim Praksivigata Chikitsa should be done. Samapachana should be done according to which dosha is involved. You see, many of the patients may have only Vata Kapha symptoms, many of them may have Kapha Pitta symptom, many of them will have Pitta Vata symptom. If that's what I told now, if Pitta Vata is there, you give Madhura Ganavashadi, Kapha Pitta you utilize Tikta Rasa, Vata Kapha you utilize Katu Rasa. So Tarishadi Este Shunga or Sitopaladi Este Shunga or Kantakari Churna with the Shunga Bhasma. Like that you can utilize any drug. And Rasavashadi is Tambra Bhasma or Malasindura. If it is more of Vata Kapha, utilize Malasindura. More of Kapha Pitta, utilize Tambra Bhasma. More of Vata Pitta, utilize Pravala Bhasma or Kamada Mukta. This you utilize it. Like that you can use Rasavashadi you can use. And Avaleha it is